So my name is Myra J. King. I am in my 30s and I grew up in the Washington, D.C. area, and I work as an HR business partner for an aviation company called Satair. We are a subsidiary of Airbus Americas, and my role requires that I interact with people from all walks of life, and so it's a very pretty physically active role in that I am on site. And for the last maybe 10 years or so, I've struggled with pain with my menstrual cycle. I never necessarily knew what was wrong until I started to go through my regular checkups with my OBGYN. And it was always, oh, you should probably get on birth control or take pain medicine. It's probably just, these cramps are normal. And it just never felt right. And I started to do research, and then I came across a GYN surgical center and read really fantastic reviews. And I decided to take the plunge and look further and figure out what was really wrong. Yes. So I started to do research, and it seemed that the symptoms that were described matched what I was experiencing. Pelvic pain, lower back pain, pain in my legs, problems with bowel movements, constantly having to use the bathroom. I just was not sure why it always cycled that way. And I went to see a specialist, and they said, I think it's endometriosis, but in order for you to know, you would need to get laparoscopy procedure done. And they recommended a place that they knew about, but I just thought I really wanted to advocate for myself and do my research and find someone experienced, just because I had heard so many horror stories where they couldn't pinpoint what the problem would be. And that's how I came across Dr. Paul McGall. Hopefully I'm pronouncing his name correctly, but he just was very direct. He sat me down. I went to the appointment with my husband, and he drew out what the surgical process would be like. Pretty easy, very invasive, but still would require for me to take some time off from work. And I just thought, I'd read so many great positive reviews from women that also didn't understand what this pain was, and what solution could be there for them to improve their wellness. And I just truly trusted what I researched, what I read, and what he said. And the staff was just so, responsive with any questions that I had, and walking me through everything. So I felt very comfortable very quickly. The biggest fear was that they would say it's not endometriosis, or we don't know what's wrong. And just having that assurance that they would get to the root of the problem, of what was causing pain. And sure enough, it was endometriosis. They confirmed it, they found it. And so I felt very relieved knowing that I made the right decision. But I just really appreciated the transparency and knowing, look, these are the steps that we will take to tackle this. This is what will happen. This is the type of preparation you will need, which was nothing super complicated either to prepare for the surgery. But just knowing that there would be even though it may not solve everything in the end, but just having relief and understanding and feeling validated that, what I felt is really endo, and not many people know about it, and they call it the invisible illness, because they'll say you look fine, or are you sure it's just maybe some cramps. And so I just felt very much validated that I finally found a place that understands and is really making a difference in women's lives to improve. Going into it, of course, I was nervous, but again, the staff was just so amazing and partnering with me prior, making sure I received clear instructions on what happened, the time of the procedure, all super organized. I actually had to travel to the New Jersey Secaucus site for it, but there was very convenient transportation to get there. So my husband accompanied me, and I also got to engage a bit with another patient that was there before me for her surgery. So just a big support system overall, very seamless. And recovery has gone quite well. I was able to move around a bit, and that was always my goal, to make sure I moved around every few hours with assistance at first. And I would say minimal pain. I still, of course, have pain, and I was told, look, it may take at least 3 or 4 cycles for it to improve, but I've always just known that these things take time, and I everything that was pretty much communicated to me has transpired in terms of recovery. So all gone well, and so no regrets at all in getting the procedure done. So it's been over a month now. Still definitely have pain, but I would say compared to the pain that I never knew what it was, I would say I definitely am on that road, I would say, to recovery for sure. So definitely still have some rough days. I think it's something that impacts you physically and can impact you as well mentally. But I think the biggest point of the recovery has been the support system I've had, and just the fact knowing that I'm not alone, and that my feelings are valid. What I'm going through physically is definitely part of it. So I definitely am feeling a lot better compared to where I was maybe a year ago, not understanding what was wrong. So definitely just on a much better pathway. Say don't wait. I think that was something that I don't have many regrets, but that's probably one where I just wish I would have done something sooner, and not really just believe what I hear, that it's, oh, this stuff is normal, and it's definitely something that you have to stay on top of and take care of yourself. I would say definitely do your research. I'm just so thankful that I found Dr. Paul McGoll and his staff, and I read many reviews, and I know he's quite experienced in his team. So that's something that was just really nice to see, and just the awareness of it, understanding the pros and cons. I think even if you're not comfortable, but just asking questions is super important. And so there was always room for me to ask questions, and I think that was the biggest takeaway. I felt very comfortable knowing I chose the right place to get this procedure done. Thank you. I'd say just the compassion and kindness. I think that goes a long way in the team, and you can see the level of care and support that the patients had. I definitely will say you're in such a vulnerable state when you're going through this, and there's just a lot going through your mind, and you just want to recover and feel well. And I have to say, I just felt very cared for, and of course I was nervous. I didn't know what to expect. So just super thankful, and I know that if I encounter any issues, I certainly will be back to follow up and make sure that I'm on top of it. So that's my advice to other women that are experiencing pain, and just to definitely follow your instinct, and again, trust that the level of care you receive, once you've met the staff and read the reviews, it's definitely there. And I think that it will continue to make a difference in women's lives.